Carrie, how can a speech-language pathologist ensure that a system will be successful in implementation?
Well, there are some things that we can definitely do that are going to work in our favor to make it more successful. The first thing is to remember, like with any of us, if we're going to have change, it has to be easier than what we're already doing, it has to be more effective than what we're already doing, and it has to be readily available. So if you think about any of us, if we're going to make a change in our lives, we need these three things in place. Well, think about we also need these things in place in order to get a student to go from whatever their current mode of communication is to a mode of communication that we want to facilitate, but we also need them to be really motivated to do it. The next thing that I would do is remember that high tech does not always equal the best choice for communication. I know a lot of times there are people who see the amazing devices that are out there, but especially with our students with autism, once they have a mode of communication, we still really need to consider the social and pragmatic components, which historically are areas of deficit for children with autism. So we also have to remember that they not only need the mode of communication, but they also need to have the motivation to communicate. Then finally, I think the most important thing to remember is that our roles as speech-language pathologists might be different than some of the traditional roles. When I say traditional, I'm talking about direct speech-language therapy. We might play more of an educational role or a consultative role. So what we want to do is educate the family, educate everyone who's in their academic setting, and make sure that they know not only how to maintain the system that's been chosen, but also they know how to communicate with that student and give that student opportunities to communicate.
Sometimes it's hard for clinicians to let go of that control. They want to be the one implementing the therapy.
It's true, and there is still some direct implementation, but really once you get the families on board and educated about how to use the system, it's great because they come back from a weekend with things I would have never thought to add to their system. So really, once we can start to release some of that control, you see that a lot of the work is done for you, and actually a lot of things that you maybe never would have thought about implementing has been done by the family or by the maybe teacher or someone in the academic setting as well.
Carrie, thank you very much for coming to talk to us today.
Oh, it was a pleasure to be here.